Can diastolic dysfunction predict mortality in septic shock? This new multi-center study questions long-held beliefs. Septic shock still claims about 30% of ICU patients. While we know it impairs both systolic and diastolic function, it's unclear if left ventricular diastolic dysfunction predicts mortality. Past studies were small, inconsistent, and excluded real-world ICU patients. This was a prospective, multi-center observational study across 10 French ICUs. 402 patients with septic shock, sepsis 3 definition was used, were enrolled. Echocardiography was performed on days 1, 2, 3, and at follow-up. Diastolic dysfunction was diagnosed based on American-European guidelines. Statistical analysis included logistic regression adjusted for SAPS-2, SOFA, and fluid balance. Left ventricular diastolic dysfunction was highly prevalent, seen in 76% of patients during the first 3 days. Yet, DAY28 mortality was similar, with left ventricular diastolic dysfunction, 26%. Without left ventricular diastolic dysfunction, 28%. Even after adjusting for illness severity and fluid balance, the association remained non-significant. Also, left ventricular diastolic dysfunction improved or normalized in 33% of survivors by follow-up. Interestingly, patients with grade 2 or 3 left ventricular diastolic dysfunction had lower fluid balance, likely due to clinician awareness and conservative fluid strategy. Strengths: large cohort, real-world ICU population. Standardized echocardiography. Included patients with AF and known cardiomyopathies. Limitations: not powered for mortality difference by left ventricular diastolic dysfunction grade. Echocardiographic bias possible as physicians were not blinded. Missing follow-up in some patients. So what does this mean? Left ventricular diastolic dysfunction is common in septic shock, but it does not predict 28-day mortality. This challenges older meta-analyses and suggests routine diastolic assessment may not guide prognosis. However, it shows left ventricular diastolic dysfunction may be reversible, an insight worth exploring in future research.